So here they are, my top 5 favorite hip flexor activations. I'm Dr. Ryan Dawson. Thank you guys so much for joining me today. This is Flow State Movement. If you guys like these functional movement videos, be sure to slam the bell and subscribe to all my videos. We have a lot more coming here. I wanted to share with you guys the top 5 hip flexor activations that I use in my office on my athletes. So let's take a look. Okay, so the first exercise here, we really want to over-exaggerate hip flexion, and one of the best ways to do that is laying supine, grabbing your knee and wrapping the TheraBand or the resistance band around the femoral neck or as close as possible to the inside part of your hip as you can get. That's going to pull the joint down while you pull your knee up, creating some space in the joint. The hip and the shoulder are ball and socket joints. They're two of the biggest engines in the body for movement. They're going to allow our body to move in all directions because of that ball and socket shape. And so we want to remember that as we go through this movement, we're moving internal, external across the body, bringing the knee up and back down, getting a nice activation into the hip. Okay, so the next activation we got here is the kneeling quad and hip flexor stretch. This is an amazing activation for getting the anterior compartment opened up. So as you can see, I take a knee and I wrap the band around the posterior aspect of the femoral neck so that it's pulling me from posterior to anterior, and then I'm leaning forward, getting a deep stretch into that anterior compartment. Remember, if you guys feel this activation in your low back, we're not doing it correctly. We want to maintain a neutral pelvis and lumbar spine. The best way to do that is to activate the transverse abdominis muscle. That's going to be pulling your belly button back towards the spine, bringing your pelvis back to neutral position, and then from there we want to extend the hip. So as you guys can see here, I have a TRX bar with a rubber band or resistance band on the end of one side, and I'm using that to activate my core as I rotate my spine left and right, as well as laterally flexing to the opposite side. That's going to give me a nice activation, but also a deep stretch into the obliques and into the lateral compartment of the hip, as well as the hip flexors. So give that a shot. Remember to breathe and relax the muscles as you go deeper into the activation. This next activation is a progression of the last one, very similar. All we're doing differently here is I'm going to rotate my down leg, in this case my back right leg, where it rotates externally, my foot comes in, and then I lean forward into a nice adductor stretch. This is great for the adductor Magnus. When we get tight on the inside part of our leg, we want to take some time and really open up the adductors on the interior compartment. All right, lastly here, we're gonna finish up nice and easy with a little Soaz Release, using one of my favorite self-care products. If you guys haven't seen my video on my top 5 self-care products, jump over and check that out. But the Right is something I recommend a lot, and I just want to give a shout out to those guys. Thank you so much for this amazing product. What we're gonna do here is lay on top of the device in a prone posture and let the Right fall into the lower part of your abdomen. Now this might feel a little uncomfortable if you've never done this type of tissue release before. You probably have some trigger points in there. That's why we're doing it. We want to remember to breathe and relax, and on every exhale we let it sink a little bit deeper in. If you feel yourself starting to resist, take a little break and start over. The Soaz Release is an amazing tool for low back pain because the psoas muscle actually inserts on the anterior aspect of the lumbar spine and pulls down into the anterior part of the femoral head and neck. And so whenever we get flexed forward and we spend too much time in the chair, we have a hard time going from seated to standing. This muscle gets tight and can pull on the low back, making it very difficult to not have low back pain and anterior pelvic tilt. So we want to make sure that we take a little time at the end of our stretch and our activations to get a nice myofascial release. And that is my top 5 hip flexor activations for the day. Thank you guys so much for joining me. If you guys like this video, be sure to subscribe for more, and I look forward to seeing you at the next one.